Esteemed Dadiji Rajyogini Dadi Ratan Mohini ji, Chief Guest of this valedictory function, a very dynamic, young and energetic, healthy Health Minister of Rajasthan, Dr. Rajkumar Sharma Sahab. Doesn't he look very healthy, energetic, you know? Brother Nirvatji, the organizer of this conference, what I could gather is Dr. H.K. Chopra Sahab, Dr. Satish Gupta ji, Dr. Banarsi Lal ji Shah Sahab, and gentleman on the dais whom we, as a student, heard his name when we were getting trained as a cardiac surgeons and cardiology. That is Dr. Naveen Nanda Sahab, who is known as the father of echocardiography in the all over the world, and India is proud of it. And we are happy that the galaxy of visitors which are sitting around here, who have come from all the way, the famous cardiothoracic surgeon Dr. Mukesh and many others who are here, whom I know personally through their work. Let me tell you, I was one of you. I mean, I did my post-graduation MCH cardiothoracic surgery from CMC Vellore in early 78, and I had done fellowship in British Commonwealth Fellowship from Southampton University, and got trained as a cardiac surgeon. Started my cardiac career in SMS Medical College as a lecturer, and then rose to become the professor and head of the department, and eventually got my MCS training program started in SMS Medical College, and I am proud to say that the program runs very well, and very well trained boys whom I taught, they do much better surgery than I ever did in my life, But friends, let me tell you, somehow or other, I took an administrative job of a superintendent of a biggest hospital in Rajasthan, that is a SMS Medical College, Jaipur, and came in contact with some political people, and some of them are very good. And one of them is the present Chief Minister of Rajasthan, Mr. Ashok Gehlot. The other one who's no more, whose name some of the Indian, every Indian knows, is Mr. Rajesh Pilot. And they induced me into the politics, and while I was on growing very well in my profession, I suddenly jumped into what they call as a cesspool of dirt, and that is what is the politics, where me and Dr. Rajkumar Sahab is there. And then ended up becoming MLA, and then was Member Parliament, and now Ashok Gehlot Sahab has entrusted me with the responsibility of monitoring certain programs in Rajasthan. Having said that, what I gathered from the deliberations which the eminent faculty members gave it here, the scientific deliberations were of course very superb. Every aspect of cardiology, cardiac physiology, echocardiography, where the father of echocardiography is sitting. I'm sure these all energetic youngsters from Medicity and other part of the hospitals, I think the part of temptation are that they are doing the echo under the guidance of Dr. Naveen Nanda Sahab, so that they can clear their doubts and everything, But I started my career in 78 when the bubble oxygenator was being used. Disc oxygenators were there, and I mean, the mortality used to be so much. I used to count the drops by eye, there were no syringe pumps and things like that. And now we have ended up in an era where you do off-pump surgery, and I mean, there was a time when the whole rush was going to Houston. Everybody who was a bit of name in India would go to Denton Cooley, and then the time came that little less affluent would go to Harley Street Clinic. But I'm very proud to say that now we have state-of-art hospital in our own country, and we have very good, not only in the metros, but in a city like Jaipur, where there is a very good cardiacs, about more than half a dozen cardiac centers where there's state-of-art surgery is being done. Of course, not like Dr. Mukesh's transplant surgery, but rest other surgeries, whether it is a congenital of a 1 kilo baby or newborn baby, not of course intrauterine. But the fact remains that despite of increased technology, increased knowledge, we still remain the static. And that is where I think this particular venue of the conference, in the serene atmosphere of Baba Brahma, where the ultimate message which has come through is that only the science is not the answer of all the maladies, all the diseases, and it has to be substantiated with the spirituality. That's what my sister doctor was telling here, that here she found a blend of spirituality with medicine, with surgery, and I think here I saw the program, the mind, body, soul connection, and I appreciate Dr. Gupta's effort, and I read that paper in Indian Heart Journal where you have compared the result, where you have shown total regression and substantial regression in the blockades in coronary artery, and documented with your angiography profiles, you know. Although I will be very, very apprehensive if I have 100% blockade, and maybe I can't find a courage to follow your line of treatment. But I think there is a definite answer where many times we find an angiogram showing it's a 50%, 60% blockade. I think those are the places where your three-dimensional approach, which you have coined that term, and which everybody is taking home that message, that Dr. Mukesh said, now that the first D would be the spirituality and the correction of the soul. That is what everybody will be taking up. Having said that, I know you all will be eager to leave soon, but I have visited this place and found very few organizations, no other organization which is doing that kind of service. I mean, I was in Mount Abu and saw a global hospital in a very remote area where there's hardly any facility. I, being a government representative, my honorable minister sitting here, I can tell you, but for the Global Heart Hospital, which Baba thought many years ago and created that institution, lives of those poor people couldn't have been saved. The 5,000 operations that you do every year for a cataract surgery couldn't have been done here. I mean, although my chief minister is very human and very considerate, and some of you might take message that he recently has announced that everybody would be provided with free medicine in all the government hospitals. And believe me, people coming for general surgery, routine ailments, all commonly used drugs are being provided by the government. The people who are below poverty line, whether they are getting a bypass surgery done, or whether they are getting a transplant surgery done, or whether getting a pacemaker implant or ACT implant, this thing, every money penny would be given by the government. And even those who are not so rich, there also 40% would be subsidized. But despite of that, government is not able to do what it should have been doing to the maximum capacity. And that is where the role we must appreciate, we feel obliged. Had Baba Brahma would not have come and settled in Mount Abu, at least this area of a tribal area would not have got the services. Did you visit, Dr. Saab, this old age home of this institution? It's marvelous. I can't expect that kind of service being rendered. I've seen the hospices and old age home in England and other parts of the world, but the kind of care and the compassion which comes from the basic training of which is being imparted of selfness, purity, calm, quietness, helping people, which is emerging from this Raja Yoga, I am sure that is the answer of many of the problems. And I feel that you are all carrying that message, and we want that the more blend of spirituality has to come into the medical practice. We can't be just mere technician and just putting grafts and forgetting it. I think we have to educate our people, our lifestyle modification, meditation, about diet, about every aspect of it. And I know the conference has been a great success, and I appreciate Dr. Chopra, Dr. Gupta, and all those who have organized, and especially thank you all the dignitaries who have come from far and wide, and we welcome you to this country, and we hope that you will keep coming again and again to this place, and this message of peace and love and harmony would be spread all over the world as desired by Baba and Dadiji. Thank you, ladies and gentlemen.
Thank you, Dr. Karan Singh ji. Now I request Dr. Rajkumar Sharma, the Honorable State Health Minister, Government of Rajasthan, to please address us. Dr. Rajkumar Sharma.